Uniform and Hygiene. Hi, my name is Haley and I'm a nursing student today, and what we're going to be doing is performing a head-to-toe assessment on you, which means I'm going to have to touch you to have your permission.
Yes.
Okay, and if any point this becomes uncomfortable for you, you just let me know and we'll stop, okay?
Okay.
Can you tell me your name and date of birth?
Cassie Hubbard, 26-2000,
Okay. Do you know where you are?
Southern,
Do you know about what time it is?
5 o'clock.
Okay. And do you know the president's?
Donald Trump.
Patient is alert and oriented ×3. Patient's posture is erect and patient looks comfortable. Patient is dressed well and appropriate for the situation and time. Patient appears stated age. Okay, I'm gonna have to put my hands on you. Is that okay?
Mm-hmm.
Patient's hair is brown, clean, and evenly distributed. No lumps or lesions. You feel any tenderness?
No.
Okay. Patient feels no tenderness. What I'm gonna do now is I'm going to look at your skin. Patient's skin is warm, pink, and dry. Skin turgor is less than 1 second. And capillary refill of the nails is less than 3 seconds. Nails are clean, round, and no clubbing is noted. Okay. What I'm going to do now is I'm going to have you cover your left eye, and I'm going to have you to follow my pen line, okay?
Mm-hmm. No.
Okay, another eye.
No.
Cranial nerve 2 is intact. What I'm going to have you do is keep your face looking at me, and without moving your head, follow my pen line, okay?
Mm-hmm.
Cranial nerves 3, 4, and 6 are intact. Patient was able to complete the 6 cardinal positions without any difficulty. I'm going to look at your pupils, okay?
Mm-hmm.
Pupils are a 6 bilaterally. And constrict to a 4 bilaterally. Okay, I'm going to put my hands on you again. Patient's conjunctival sac is pink and moist. Sclera is white and red veins are noted. And what I'm going to do now is I'm going to shine this light in your eye one more time, okay? I can take my glasses off. Okay. Okay. Red reflex is noted bilaterally. Okay, I'm going to go ahead and look at your ears. Ears are symmetric bilaterally, pink and dry. You feel any tenderness?
No.
Okay, no tenderness noted. Alright, I'm going to stick this light in your ear, okay?
Mm-hmm.
Okay, patient's tympanic membrane is pearly gray and cone of light reflex is noted at 7 o'clock in the left ear. Okay, come to the other side. Okay, patient's tympanic membrane is pearly gray and cone of light reflex is noted at 5 o'clock in the right ear. Okay, what I'm going to have you do now is close your eyes and smell for me.
Peanut butter.
Alright, cranial nerve, okay, and I'm going to have you clench. Cranial nerve 1 is intact. Okay, what I'm going to have you to do now is close your eyes and tell me when you feel this. Touch your face.
No. 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 No.
Okay, and clench your teeth for me. Okay, cranial nerve 5 is intact. Okay, I'm going to stop here and go back and to do a part that I forgot, okay? Patient's head is round, normocephalic, and midline of the shoulders, okay? I'm going to come behind you now and I'm going to palpate your lymph nodes. You just tell me if you feel any tenderness, okay?
Mm-hmm.
Pre-auricular, post-auricular, occipital, posterior cervical, jugulo-digastric, submandible, submental, deep cervical chain, superficial cervical, and supraclavicular. Any tenderness?
No.
Okay. While I'm here, I'm gonna have you to open your mouth for me and back down. Okay, no TMJ is present. Okay, I'm gonna come back around to you. All right, what I'm gonna do now is I'm gonna look in your mouth. Patient's lips are pink and dry and symmetric. Okay. Patient's buccal mucosa is pink and moist. Lymph nodes are +1. Patient's teeth are white and in a straight line. And no dental caries are noted. Can you stick your tongue out and say ah?
Ah.
Patient's uvula rises at the midline with no difficulty. Patient's tongue is pink and moist. Patient's palate is also pink and moist. Okay, can you swallow for me? Okay. Cranial nerves 9 and 10 are intact. All right, what I'm going to do now is I'm going to have you close your eyes and tell me if you taste sweet, sour, or salty.
Sweet.
Okay. Now I'm going to have you to raise your eyebrows, smile, and puff your cheeks. Cranial nerve 7 is intact. What I'm going to do now is come back behind you, and I'm going to have you to shrug your shoulders against me. Okay. Cranial nerve 11 is intact. All right. I'm going to have you to repeat the words after me. Light, tight, dynamite.
Light, tight, dynamite.
Cranial nerve 12 is intact. What I'm going to do now is I'm going to go ahead and listen to your heart sounds, okay? Aortic. Pulmonic. Herb's point. Tricuspid. And mitral. Okay. Mitral. Tricuspid. Herb's point. Pulmonic. And aortic. Okay. S1 is her best at the apex, S2 is her best at the base, S3 and S4 are not present. There are no bruits or murmurs noted. What I'm going to do now is I'm going to lift your shirt up and I'm going to go ahead and palpate for your apical pulse. Okay, I'm going to go ahead and auscultate for a full minute. Patient's apical pulse is a 2+ and is 80 beats per minute. What I'm going to do now is I'm going to come to the back side of you and I'm going to do your lung sounds, okay? All right, I'm going to have you to breathe in for me and out. All right. Patient's chest expansion rises and falls equal bilaterally. All right, what I'm going to do now is I'm going to have you tell me if there's any tenderness. You have any tenderness?
No.
No tenderness, no. Can you scoot down just for me a little bit? All right. I'm going to have you, every time you feel my hands do this, I'm going to have you say 99, okay?
99, 99, 99, 99, 99.
Okay. Now I'm going to percuss, okay? Okay, have you moved your arm for me? Okay, patient's tactile formatus was intact and resonance is heard in all of the posterior lobes of the lungs. Now I'm going to auscultate, okay? Every time you feel my stethoscope, just take a deep breath in and out for me. Patient's breath sounds are clear in all lobes of the posterior and lateral thorax. I'm going to come around to the front and do the same thing, okay? Every time you feel my hand, say 99.
99. 99. 99. 99. 99. 99.
Okay. Patient's tactile formatus is intact on the anterior thorax. What I'm going to do now is percuss, okay? Okay. Resonance is heard over all lung fields. Okay, what I'm going to do now is I'm going to listen to your breath sounds on the front side. I'm going to touch your breast. Is that okay? Breath sounds are clear and equal bilaterally and heard in all lobes of the anterior thorax. Okay, what I'm going to do now is I'm going to go back to a part that I missed, and I'm going to palpate your temporal artery. Okay. Okay, now I'm going to listen. Okay. Temporal pulse is 2+ bilaterally. What I'm going to do now is your carotid pulse, one side at a time. Okay. Patient's carotid pulse is 2+ bilaterally. I'm going to go ahead and feel for the pulses on your arms, okay? Okay, patient's brachial pulses are 2+ bilaterally. I'm going to do your radial pulses now. Patient's radial pulses are 2+ bilaterally. What I'm going to have you do now is I'm going to have you lay back, and I'm going to auscultate your abdomen, okay? I'm going to lift your shirt up, is that okay?
Yep.
Patient's stomach is flat, round, non-distended. I'm going to pull your shorts down just a little bit if that's okay. All right. Now I'm going to go ahead and auscultate. Patient's bowel sounds are present in all 4 quadrants. Patient's abdominal aortic pulse is a 2+. All right. What I'm going to do now is I'm going to percuss, okay? Okay. Tympany is heard in the right lower upper, the left right lower upper quadrants and the left upper quadrant, and dullness is heard near the sigmoid colon in the left lower quadrant. Okay, what I'm going to do now is I'm going to lightly palpate. You just tell me if you feel any tenderness.
No.
No.
No. No.
Okay, now I'm going to do it a little bit deeper, okay? Still no tenderness?
No.
Okay, patient has no tenderness up on light or deep palpation, and none of the abdominal organs are palpable. Okay, I'm going to have you to turn your head that way for me. Okay, and the other side. Okay, no JVD is present. I'm going to have you go ahead and just stay right there. I'm going to go ahead and do your lower extremities. Patient's lower extremities are symmetric bilaterally. Hair is expectedly absent, okay? And I'm going to go ahead and palpate for your lower extremity pulses. Okay, popliteal pulses are 2+ bilaterally. Okay. Patient's posterior tibial pulses are 2+ bilaterally. What I'm going to have you do is put your feet straight up for me. Okay. Patient's dorsalis pedis pulses are 2+ bilaterally, and capillary refill in the lower extremities is less than 3 seconds. What I'm going to have you do now is take this foot and rub your heel down your shin. Okay. And the other side. Okay, patient was able to perform the heel to shin test with no difficulty, and it is equal bilaterally. What I'm going to have you to do now is I'm going to have you to go ahead and sit back up for me. And I'm going to check for your deep tendon reflexes, okay? Okay, patient's deep tendon reflexes are present. What I'm going to have you do now is stick your arms out for me and take your finger to your nose. Okay, and the other side. Can you do it faster for me? Okay? I'm gonna have you to turn your head this way, and back, and down. Alright, and have you put your arms out, up, and swing them around. Okay? Patient was able to perform the finger to nose test without any difficulty. Was present. Patient's range of motion in the upper extremities is 5+ bilaterally. Okay? I'm gonna go ahead and do a part that I forgot to do, okay? So I'm gonna have you to look up for me. Okay. Trachea is midline, no lumps, and no lesions present. I'm gonna go behind you and have you stay just like that. And I'm gonna palpate for your thyroid gland, okay? And tell me if you feel any tenderness. Feel any tenderness? No. Okay, patient's thyroid gland is non-palpable and non-tender. Okay, what I'm gonna have you to do now is I'm gonna have you to stand up for me. I'm gonna have you to walk from here to that side of the bed with your heels touching your toes. Okay, great, and back to me. Alright, great. Alright, I'm gonna have you to, let's step out here, I'm gonna have you to take this knee up and bend it down. And the other side. Okay, patient's gait and balance are both steady. Alright, I'm gonna have you to step in front of me and have your eyes closed and your fingers at your side, just for a minute. Okay, patient's Romberg test is negative. Okay, what I'm gonna have you to do now is I'm gonna have you to take this foot out, back to the side, and back in, the other side. Okay, patient's range of motion in the lower extremities is a 5+ bilaterally. Okay, what I'm gonna have you to do now is I'm gonna have you to lay back down on the bed, and I'm gonna go back and assess a part that I forgot to, okay? Patient's Babinski reflex is negative. What I'm gonna have you do is set up on the side of the bed for me. I'm gonna have you close your eyes and hand me your hands. Tell me which way your fingers are going, okay?
Up, up, down,
Okay, so,
up, down, down.
okay. Keep your eyes closed. Patient's kinesthesia is intact. I'm gonna have you to give me your hand and tell me what you're feeling.
Paperclip.
Okay. Patient's stereogenosis is intact. All right, and I think that concludes our assessment. You done great. Is there any questions you have for me? All right, thank you.
Thank you.